Pulmonary rehab for COPD is a structured multidisciplinary program combining tailored exercise training, education, behavioral support to improve quality of life and reduce hospitalizations and increases exercise capacity. Usually lasts 6 to 12 weeks. It helps patients with chronic breathing problems manage symptoms, increase muscle strength, and reduce breathlessness. Key aspects of pulmonary rehab for COPD target exercise. It includes aerobics resistance and breathing exercises designed to improve endurance and muscle strength. Education and support. Patients learn about their condition, proper medication, breathing techniques, and nutritional advice. For nutritional advice for patients with COPD, their body burns so much more, like their metabolism works so much faster just because their body is trying to breathe constantly. So they are burning more calories. And with that, which is why they are so much slimmer and thinner, because they're constantly trying to breathe. So they are thinner, and just having to eat a high protein diet helps them with that. Clinical benefits. Research shows that pulmonary rehab significantly reduces hospital readmissions and mortality, particularly when initiated within 90 days of a hospital discharge. Structure often consists of 2 to 3 outpatient sessions per week for 6 to 8 weeks throughout home-based programs are available. Why do they participate? It's to reduce dyspnea, lessen the severity of breathlessness during daily activities, improve quality of life, boost self-confidence and emotional well-being. Longevity improves in survival rates for patients with moderate to severe COPD. Patients with COPD, pulmonary rehab is a big factor that can help them build that community. A lot of people with COPD tend to have anxiety and depression just because they feel like they are alone. Nobody in their family may have this condition, so they feel like nobody can relate to them or they can't relate to anybody. Um, and being in a pulmonary rehab program allows them that sense of community and that sense of longing and belonging somewhere. And just because, I mean, they're able to share their experiences and what they're going through with people who have gone through it or are going through it at the moment with them in the process. So pulmonary rehab is very beneficial for these type of patients, and it helps them out immensely. Symptom control. So with COPD, symptom control, it focuses on reducing breathlessness and preventing flare-ups through smoking cessation. Prescribed medications, your bronchodilators, your steroids, pulmonary rehab, and avoid irritants like smoke and dust. Effective management also requires annual vaccinations, such as like your flu vaccination, your pneumonia vaccination, to give them that extra boost in their immune system so they don't have more exacerbations or are prone to infections leading them to the hospital. Proper inhaler technique, staying hydrated to thin mucus and maintain a healthy, nutritious diet. Their diet, like just like before, it is a high protein diet because they burn more calories to be able to breathe. Inhaler technique allows them to be able to get that maximum dosage in their lungs if done properly from all their medications and all their inhalers to be able to keep those exacerbations at bay and just to keep and maintain that the progression from continuing and furthering. Oxygen therapy for COPD patients is a prescribed treatment for patients with chronically low blood oxygen levels, also known as hypoxemia, typically providing supplemental oxygen via a nasal cannula to improve breathing, reduce heart strain, and enhance quality of life. It is generally recommended for severe cases, often when oxygen saturations drops below 88 to 90. Key aspects of COPD oxygen therapy when it's needed. It is used when damaged lungs cannot transfer enough oxygen to the blood, often in advanced stages or during exercise and sleep. A lot of COPD patients use CPAPs or BiPAPs at night just to kind of keep that oxygen in their system and their blood um, during that time. Benefits are long term oxygen therapy, typically under 15 hours a day, can increase survival rates in patients with severe resting hypoxemia, just like at bedtime. It reduces breathlessness, fatigue, and cognitive issues. Cognitive issues comes in with if there is not enough oxygen in the blood that can get to the vital organs, including our brain, the person can be lethargic, confused. Um, Delivery method for oxygen is through portable concentrators, oxygen gas cylinders, liquid oxygen devices. Dosages and safety. It is a prescription medication. Oxygen is considered a medication. But too much oxygen can be harmful to anyone, especially to COPD patients. They are usually very um, hypercapnic, which means that their CO2 levels are always at a higher, like a little bit of a higher um, above normal range. So they just tend to hold those CO2 numbers. And if we blow their CO2 off, meaning we are providing them way too much oxygen that they are used to, it kind of allows them to stop breathing. Like their brain's like, oh, I'm getting everything I need. So maybe I should stop functioning. So we can kind of knock them out. So we try to titrate and target the saturation, their SpO2 between 88 to 92. Um, Obviously, because oxygen is very flammable, we never want to smoke or use any open flames near any type of oxygen equipment. And then impact on survival, while it is essential for severe resting hypoxemia, studies show it does not necessarily prolong life for those with only moderate, temporary, or exercise induced low oxygen levels.